In our last episode, Dr. Susan Brown, an exotics veterinarian, showed us how to do a physical exam on a bearded dragon. This time, she's going to show us how to do an exam on a snake.
Okay, so today we're doing an exam on my little snake here. This is Pearl. She's pretty young. She will be 1 in September. And she's been a healthy snake so far. She is a king snake, and basically her color pattern gives her the name. The type of king snake is Arizona mountain king snake, which gives her that red and white and black color pattern. She's rather small still, but she will eventually be about 5 feet long and about this big around. So.
And what do you feed her?
She eats only fuzzy mice.
Okay.
And she eats about once every 10 days.
All right. And what do you keep her in at home?
She lives in a terrarium, a glass terrarium with bedding at the bottom, which is like pine bedding. Not
Okay.
pine, but it looks like pine.
Okay.
And
How does she get water?
She has a water bowl.
All right. So she just sticks her head in there and just drinks away. All righty. Very good. Okay. Well, we're going to do a quick little exam on this snake today. This absolutely gorgeous snake. And as you can see already with Jenna holding her, she wants to keep moving a lot. And so if we try to restrain her and hold her tightly at any point, we have to sort of try to work with movement here. She's going to start to get really upset. So for the moments where we need to hold her to take a look at something more closely, we try to do it very quickly, release, give her a chance to recover, and otherwise try to take a look at her as she's moving. So since she's right here in front of us, moving along through my hands, I can easily feel if there's any lumps or bumps on her, and I can see from the top and the bottom, she'll continue to want to move through my hand like this. So I can gently rotate her and look at the bottom, and you'll notice that the bottom has a different pattern than the top. Okay, the scales on the bottom are much larger, and they go in a crosswise pattern like this. So it's very different on the belly. And these scales being like that make it help her to move along. To have a long, wide scale like that helps when you're trying to move along the ground. The scales on the top are much smaller and closer together. Although if you were able to look at these very closely, you would see that if you stretch the skin just a little bit, there's actually just really soft skin in between those scales. So if you had to give a shot or any kind of injection like that, you would go between the scales. All right. So I felt her body. She's in excellent body condition. She's not too thin. A snake that's too thin, you'd be able to see her little backbone really, really sharp all the way down her body. It's not the case here. She's very good condition. I'm going to have Jenna support her back end because I'm going to try to take a peek at her head. Now, in a bigger snake, actually even small snakes, you can use maybe like a little tongue depressor or something really thin to open her mouth. I'm going to try to very gently just use my fingernail, because she's very small, to just gently see if I can apply a little pressure. Sometimes you can also apply pressure from the jaws and get her mouth to open a little bit and then open it a little bit more. But you can use a speculum. There's all kinds of things. Before I open her mouth, we're going to notice that her eyes are sort of protruding out normally on both sides of her head. They do, when they shed the cap that's over the eye, but they can't close their eye. They also have a little bit of a nasal opening, nose opening here. You can see on either side. I don't know if you're able to see that at all, but she's got two darkish colored little nose openings there. Okay. What she doesn't have are ears. She does not have any ears. And they don't need ears to pick up vibrations. They pick those up by being on the surface of the ground and feeling the vibrations through the ground. All right. So I'm going to put just slight pressure on her jaw, very slight. Try to take my fingernail and open her jaw very carefully. And just mostly, I'm going to try to turn her towards the camera here in a minute. See if we can see that her color is nice and pink. All right. And I know you can't see. I've got these glasses on to try to look a little more closely. But she has sets of teeth all the way around. I'm going to give her a break here and let you hold her a second while I talk. They have teeth all the way around that are sort of curved backwards. Very tiny at this point, but still if she bit you at this point, She still could scratch the skin and make it bleed. It's not dangerous in any way, but those are very sharp teeth. And they're curved back, so when she's eating and she grabs a hold of her prey, it helps to pull the prey into her mouth. You also may be aware we need to be careful when we open their jaw, because they actually can open up their jaw quite widely, the way that their bones are all connected, and the soft tissue there, they can make their jaw very wide and swallow something that's actually bigger than their head. And they can, stretch the tissues to get it down. All right, so we may not be able to see this in her, but her heart is going to be about 1/3 of the way down her body. And let's see. And sometimes if we turn them up, her head can be in a normal position, but if we turn them upside down and we hold them quietly, sometimes you can see a heartbeat. But I'm just going to tell you, it would be somewhere in this area, especially in bigger snakes. If you hold them upside down, you can see the heartbeat. It's quite slow. One of the things we can see, and I'll see if I can do this for her, is you can see her breathing. I don't know, did you see her? A little bit ago, she took a big breath. The lung is very long. They only have one. They don't have two. They have one lung, and it's very, very long. And sometimes if you need to see their breathing, you can either lay them out like this and prevent them from moving forward and just try to watch the breathing, or you can flip them over like that. Now, as far as feeling their abdomen and what's in there, like I've done in these other animals, it's not that easy because there's not that much there to feel. But what you can do, if you want to hold her front end and give her something to there, she'll feel more comfortable, is about her intestinal organs and all that will be start about halfway down her body, and you can take your finger and sort of put light pressure upward. Pressing from side to side is not so helpful because they actually have ribs all the way down their body. But pressing up from the bottom and going down gently, sort of like massaging, you can feel if there's any lumps or masses, anything that might seem abnormal there. And then the final place we're going to take a look is right here on the vent area. All the waste material, urine, stool, everything comes out one opening. And that's this one, I don't know if you can see it, there's one scale right there that covers that opening. Reproductive organs, come out through that opening. If it's a male, they'll have these little hemipenes in the part of the tail here, which will evert and come out. But at this point, basically, we're just looking to make sure that this area is not swollen, that there's no material crusted on there, and everything's looking good. All right. Tail is in great condition here, great, excellent body condition. And at this point, that's about all we can do on the snake. She looks really good, great body condition. We're looking for activity. She's flicking her tongue. That's another important thing. Can you see the tongue flicking? The tongue flicking is important. Snakes that are very ill sometimes will either not flick their tongue or flick it very, very slowly. Okay? Her tongue flicking is very quickly, and she's picking up scent in the environment, and she's picking up all kinds of information with that tongue and bringing that back into her mouth.